Prevention Live. Prevention Live is presented by the Prevention and Community Collaborations Department of the Center for Health Innovation. I want to encourage you to engage with us today, have a conversation with us, give some input, ask questions, put them in the chat. Our staff will be working behind the scenes, checking all those questions, comments, and get back to you as soon as possible. As with other of our presentations dealing with medications, we're going to largely focus on prescription painkillers or opioids, but these tips hold true for many medications. But let's talk about prescription medications. I want to tell you a story about my mother-in-law. Anytime I complain of a muscle pain or a headache or something like that, she's quick to offer me one of her prescription pain medications. She doesn't know that this is potentially dangerous thing to do because what may be right for her may not be right for me. So I want to share a stat with you. About 20% of New Mexicans got a prescription painkiller from a source that was not a doctor or a dentist. I also want to share with you that almost 40% of New Mexicans reported using prescription painkillers for a reason other than to treat pain identified by a doctor or a dentist. In Southwest New Mexico, 19% of high school students, those in grades 9 through 12, reported improperly using a prescription pain medication. Taking medications that were not prescribed for you by a doctor could have several consequences. So I'm going to talk to you about that. The problem is that an adverse reaction could occur in the person who receives and takes the pill. Medications affect people differently. Doses may be different based on many different factors. These adverse reactions could need medical attention or could even prove to be fatal. But one thing that a lot of people forget is that it's illegal. There are federal and state laws against sharing prescription medication. In New Mexico, it's the Code of New Mexico Rules Title 16 specifically talks about that. So here's some tips for you, some practical tips. Keep track of your medications. Take medications only as recommended by your doctor. And make sure you follow your child's school policy for medications that need to be taken to school. We want to encourage you to follow all these Southern New Mexico prevention programs that are currently on your screen so you can have more information on how to keep your families and loved ones safe. All their social media platforms are there on the screen, so be sure to follow them to get all that great information. And one last thing, I want to invite you to attend next week's Prevention Live. The subject is going to be the youth brain and how alcohol affects it. It's going to be presented by Renee Meraz. It'll be on May 6th at 7 p.m., so be sure to mark your calendar for that. I want to thank all of you for attending today's Prevention Live. I wish you all a very safe and wonderful night.